Hello everyone, my name is Jillian Deutsch and I'm one of the healthcare reporters here at Politico. And today I'm super excited to be sharing this conversation about self-care. As we all know in the health bubble, self-care and mental health were always going to be bigger issues this year, considering we have a former child psychologist who became the health commissioner, Stella Kyriakides, just last year, even though it feels like years ago. And it was just last year that she was in the health committee saying that mental health was going to be a key part of her mandate. And so that's why I'm so excited to have this conversation, especially now that with the pandemic, mental health has never been so important. For this conversation, we have four really interesting people we're going to be speaking with. We have Clive Needle, the Senior Policy Advisor at EuroHealthNet, Christian Busoy, a Romanian MEP from the EPP party. We have Duarte Santos, President of the Pharmaceutical Group of the European Union, and Christine Sorensen, President of the International Health Literacy Association and founder of the Global Health Literacy Academy. We also have two special guests waiting in the wings to give a different perspective. And just because you're not one of those 6 people does not mean that you cannot participate. So we have 2 different methods that you can use. You can log on either with your cell phone or with your computer and go to Slido, sli.do.com. And there we have a function where you can ask us questions directly using the hashtag selfcareEU. We already have some questions. And actually, we already have a question for you guys. So if you go to Slido, you can answer the question, how much should health be in the hands of citizens? The first option is a lot. People are able to make choices conducive to good health. Second, a lot ideally, but we need to improve health literacy. And last, they should be informed, but ultimately health professionals should be fully in charge. Now, before we get started with that, though, I really want to thank our sponsor, GSK, for hosting this conversation and allow Filippo Lanzi, the head of Europe, Middle East, and Africa at GSK Consumer Healthcare, and let him kick us off. Filippo, the floor is yours.
Thanks a lot, Gillian, and good afternoon and welcome, everyone. On behalf of GSK Consumer Healthcare, I'm really pleased to be here today, even if from remote, to open this discussion on the value of self-care. And I really look forward to hear the perspective of our honorable speakers, as well as the reflection during the Q&A session. I will start by a question, which is what does healthcare mean to all of us, to the people? Most Europeans, health is really about better everyday health. It is about making sure that we have at home what is needed to treat our kids' cold and flu. It's also about keeping an active and good quality lifestyle and making all those choices that eventually will prevent more serious disease from developing in the future. I really believe it's very timely to hold this conversation now because COVID-19 has prompted an increased focus on self-care and has also taught Europeans to become more aware of their everyday health habits and also adopting new behaviors. A recent survey made by Ipsos showed that 63% of the Germans, 84% of Spanish consider important to take control of their health and relieving the pressure on the healthcare system as well. Now, self-care matters. Self-care is a key component of a sustainable and patient-centric healthcare system. And however, if we look at the situation today, I believe there are still several barriers that prevent self-care from reaching its full potential. If we think about these barriers, first of all, preventive approaches can be cost-effective in the short as well as in the long term. But today, 80% of the spend of the budget in Europe is spent on chronic disease, only 3% on prevention. Also, despite a large interest in self-care demonstrated by individuals, health literacy seems to be one of the greatest barriers to self-care. And also, self-care doesn't mean alone care. We don't want people to feel they must look after themselves in isolation without seeking advice or without getting help from local experts. The role of healthcare professionals, first and foremost of pharmacists, in enabling self-care is crucial. If you think about that, pharmacies are the most widely distributed healthcare facilities in Europe, with 58% of European citizens having the possibility of access a community pharmacy within 5 minutes. I strongly believe that now is time to work together across the public and private sector to overcome the existing barriers and to create an ecosystem of support for self-care to thrive. Self-care is somehow a hidden force within our healthcare system and often goes unnoticed. So I really believe we need to change that. That's why today I want to call for self-care to take a more prominent role in the European pharmaceutical strategy. How? By investing in a health literacy program in order to empower individuals to go through in education, to promote the role of pharmacists as key enablers to bring self-care to the people. And then through partnership, because I think companies like ours really need to work in partnership with people, policymakers, healthcare providers, and professionals to create a truly seamless ecosystem. Finally, for most Europeans, health is really about better everyday health. At GSK Consumer Healthcare, we want to help redefine the role of self-care because we think that in people's lives, this can bring a long-term benefit for both individuals and society as a whole. Here, let me quote the Commission President Ursula von der Leyen, who recently said, "We need to learn from the pandemic, and for me, it is crystal clear we need to build a stronger European health union." For me, as a business leader, but first of all, as a European citizen, this means a strong healthcare system in which self-care plays a prominent role. Thank you. Enjoy the discussion. And back to you, Gillian.
Thank you so much, Filippo. Now, for all the panelists here, I want to start off with a bit of a difficult question for you guys. I have two questions, and I want you to answer in just 1 minute. First, self-care is obviously a very broad, general term. So I'm curious, from your perspective, what does self-care actually mean? And second, what did you do during the pandemic to take care of yourself? And I will start with Christine.
Thank you for the question and for the opportunity to be here. And in 1 minute, I would say self-care is about self-awareness and self-management and self-testing so that you're able to take good care of yourself and your families and your loved ones in everyday life where you live and love and work and spend your time. And during the pandemic, I tried to take care of myself, not only in physical health. I actually bought a spinning bike for home because I couldn't go to my usual fitness center, and also trying to enhance mental health and my social health by staying in close contacts with family and friends, using social media, for example, and also trying to keep up the spirit, because we do know that this is only about taking care of the not getting the virus. It's also about being resilient and keep doing what we used to do and keep up our work.
Absolutely, Christine. I missed the gym so much as well. Clive, it's your turn.
Hello, thanks very much. Well, first of all, we often forget, and it's a great question, but we forget what the WHO definition of health, and it's not just physical health, it is a complete state of well-being. And I think that's a really important word to use in the context when we're talking about European activities. It's in the European treaties, it's a duty, and there's a lot we can do about that. So health to me means a complete state of social, mental, physical, and environmental well-being, and we can touch on what the determinants of those are as we come through this very timely discussion. And what did I do over the past period? Well, I used the opportunity to help myself to become fitter, to be active in body and mind, to be creative and to try and approach new things, but also to contribute in my local neighborhood, to look at new opportunities to contribute as I'm a patient representative locally and how we can look after and help others because we're interdependent. But I'm really lucky. And the trouble is, so many across Europe, people do not have the same advantages that people like me do. And that's why always we must put equity and fairness at the heart of what we do. And health is all about an equitable approach, whether it's personal or political.
Absolutely, Clive. I'll be asking you more about inequality soon. Christian, your turn.
I will try to do it in 1 minute because we are supposed to do it during our speeches in the plenary in the European Parliament to respect 1 minute. So taking care of yourself, of course, your own health, but which means also not only physical, but also mental health, the spirit of well-being. Respecting, of course, the indications of specialists and also using the modern tools like mobile health and other tools which can help you to take care of yourself. And a lot of prevention. Prevention is key in order to achieve self-care. During the pandemics, I was very active because we didn't stop the activities in the European Parliament. I stayed most of my time in Romania, so I used the video conference system. I tried to do sport, to spend a little bit more time than usual with my family, and also to eat healthy, which was extremely important during the lockdown in Romania.
Perfect, Christian. You definitely have that practice of a minute. Definitely, we'll drill down. And Duarte, last but not least.
Just give me the opportunity to say to Politico on behalf of PGU, thank you very much for this invitation to complement all the other speakers. It's really interesting and good opportunity to be with you. Well, I have nothing more to add radically different from what has been said considering the definition of self-care, but for sure that self-care is about take care of our own, and to take care is not just to take care of us when we are ill or sick. Is namely and even more important than that, to go on prevention and to adopt a well-being lifestyle. It's something that it really matters. Going for what I've been doing during the lockdown and during this more critical periods, I would say that even being very engaged in lots of responsibilities, of course, that I try to stay a little bit healthier, trying to eat better, also to exercise a little bit. But even more important than that, to be sure that my family and closest ones were well is something that is really important for our mental health, and that, in my case, helped me a lot. So to also to spend the time that we have to the ones we love the most is something that for me is critical.
Absolutely. Thank you, Duarte. Now, my first question is for you, Clive. Health inequality has been exacerbated by the pandemic. I'm curious because mental health, self-care, these are often things that we think of with wealthier people, right? For self-care, you go to the spa or you get a nice gym membership. So why now, in the middle of a pandemic, should we really be talking about self-care?
Well, because I think this has shown up the importance of how we're interdependent, and there are a number of different responsibilities where we all have a role to play, but also we have duties to each other duties of care. States have duties of care, and that has quite clearly been shown. What has happened is that we've become part of a syndemic pandemic. So the existing conditions with chronic and non-communicable diseases, the social conditions of inequalities which persist in every European state, in every region, in each of our communities, have been exacerbated by this whirlwind of communicable disease and threat. And this is still going to go on, and this is going to be felt, but it's going to be felt disproportionately across communities. And some people are less able to take that responsibility, and that's why we need to be careful to make sure that we provide the support that's needed. That's what health systems do. They do that most effectively. We need stability and continuity in our health systems, but we do not need it top down. And in COVID, we've seen that often health systems reverted to top down messages. They didn't consult people, and therefore there have been mixed messages, and people have been disproportionately affected. And we see this across the continent, a mismatch of different approaches where if we restructure much better, and we take into account the real determinants, the causes of what has happened, rather than just looking at the symptoms or getting into blame about how people live their lives, then I think we can really change for better. Europe is an important part of that consequence, but it works at all levels, from individual up to international.
And Clive, I'm curious, could you give us an example of when public health officials or governments were doing this kind of top-down approach?
Oh, gosh, yes. Well, it's been admitted myself. I mean, in the national health system in which I'm in, there were top-down sort of command instructions, and it's still happening in communities where you need to be able to make sure that you do not come into pandemic fatigue now. We've just been talking with the WHO Europe leadership about their behavioral insights unit, and where they're increasingly looking at what are the messages that will work realistically with people. And people are not stupid. They need to be given an opportunity to contribute not only to their own health and well-being, but also to work in their communities and work with others. So working with people who are community leaders. So we can look across the range of different health determinants, whether we're looking at obesity, we're looking at mental health, we can find all sorts of new ways. And the NHS patient engagement program in England, and this is happening in many countries across Europe, as EuroHealthNet has been working with our communications networks, we've seen the way that you communicate messages matters enormously and bring people with you. So self-care is an important part of the toolbox of measures which we can take forward. But if it's just applied and people don't build that trust, and they don't feel that they're really engaged in it, really have a stake in what their own outcomes as well as the system outcomes are, then you get that difficult separation, and people will not support the needs which systems want to try and get people to follow, which includes sustainability. We do not need just a market-led consumerist approach, but we need an interdependent, supportive approach across all the determinants of health.
Absolutely. And Christine, so Clive was just talking about pandemic fatigue. We've seen so much information and changing information as well. You know, we were told not to wear masks, then to wear masks. The travel guidance we've gotten has been all over the place. I'm curious, with so much information and misinformation out there on the web, how do you promote health literacy?
I think we have to realize that we've been building the plane while flying. In Europe, the pandemic came as a surprise, and we have seen elsewhere in the world that countries were much more prepared, governments were much more prepared. It was basically just push a button when you asked Singapore, Taiwan, other countries that had SARS some years ago, and they knew and they realized how important health literacy was, and they put a lot of resources into practicing these kind of drills for if a pandemic comes. And we didn't have that in Europe, so we're basically trying to invent solutions as we go, and some with success and others not. And what we do face is that in European countries, 1/3 to 2/3 of our populations have what we call limited health literacy. They have really difficulties in finding and understanding and judging and using information. And in this case, with the pandemic, where we're heavily overloaded with information, both good information but also misinformation, it becomes really, really difficult for many people to navigate in this jungle of information. And that's also why WHO called for action, because this pandemic is followed by an infodemic that we need to tackle.
And Dorothy, that of course brings me to you, because pharmacists have really been on the front lines of the pandemic, working tons of hours, really being the point of contact for many people. Can you explain what they've really been doing and what they've found works in teaching people how to be literate in health?
It's a very good question. It's totally linked to our daily activities, and it's part of what we are doing in the art of the communities every day, and something that for sure in circumstances where we are in a pandemic that also has lots of information, bad information and misinformation is very relevant. To tell you that, for sure that we feel that we have a big responsibility in order to support those we serve every day for critical and good information. And it's all about all the topics and matters that can be relevant in healthcare. We are speaking about people to take care of themselves when they are already chronic patients, but also it's an important responsibility, and we are accountable for, and we feel accountable for, to contribute to the well-being of the communities we are in order to prevent diseases and to avoid them to get it in the future. So it's a part of be sure that we have access and could deliver among different ways, but also in the front line, also in the face-to-face meeting, also in the face-to-face consultation of our patients and the citizens or people, to be sure that we give good information, but also information that is very well understood, because it's not a topic just to have very relevant and scientific or evidence-based information that I feel that pharmacists, of course, has a responsibility to provide, but also to be sure that we can communicate it in the way people can understand it. And this is very relevant. And I would say that community pharmacists also have the possibility and I would say the advantage that we should cover or translate into responsibility to adapt the communication for the people we are in front with, since we know them very well, and we know our I would say our patients. We know the people that stays in contact with our pharmacy very well, and for time and sometimes for generations. So we can also help and support people understanding their social context and their family needs. We can understand and take special care for those who are isolated or have special questions and doubts. So I feel that is this combination of scientific or technical and scientific approach to give the right information and human touch of the pharmacist intervention when we also know people on their own context.
Christina, I just have one more question about misinformation. There's obviously so much misinformation on the internet right now. I'm curious, is now really the time to be telling patients, take health into your own hands?
I think we cannot go through the pandemic if we are not taking health into our own hands. We have actually put a lot of responsibility now to keep up, social distances, social or physical distance, and using masks and washing hands. So there are some really concrete regulations and instructions, as was said before, top down, that health is now our responsibility, and it boils it down to survival. Where I fully agree with Clive Needle, who said this is also about well-being, and I think this is what we need to learn in the second wave. After our first 6 months of experience, we cannot boil it down to survival only. It's also about thriving, and therefore also investments has to be put to mental and social health. This is not just about isolating our vulnerable people or our patients. We cannot live without these contacts. We really have to live, but also to thrive.
Absolutely. So Christian, we've been talking, of course, about what pharmacists can do, what people can do, but I'm really curious what Brussels can actually do. We obviously had this big EU for Health program proposal that the Commission asked for 9.4 billion euros, and that was cut down to size by the member states down to 1.7 million. I'm curious now, with such a reduced budget, what Brussels really can do with the EU for Health program to tackle mental health and self-care.
It's 1.7 billion now, it's true. It's a disappointment compared to 9.4, which was the proposal of European Commission for EU for Health immediately after the pandemic started, also as a response to the high expectations of citizens. But I started to take care of this program during the last mandate of European Parliament, when I was not the president of Industry, Research and Energy Committee, but vice president of Environment and Health Committee. And at the beginning, this program was just a strand of the ESF Plus, European Social Fund Plus, and the budget proposed was 413 millions, which we proposed on behalf of the Parliament to increase at 473. So 4 times less than what we have today. So if we look in the perspective for comparing the previous programs, we have now a reinforced budget, 4 times bigger, and I have great expectations that we will increase this budget during the negotiations. I received all the support, even the President of the European Commission, Madame von der Leyen, expressed the support during the speech, the State of the Union speech, and also we are fighting inside our political party, EPP, and also inside the Parliament to increase a little bit, even this 1.7 billion. We have some priorities. One of the priorities is cancer, especially child cancer, pediatric cancer. Among the priorities also the mental health, because we need to concentrate a little bit on this. We see an increase of cases. We see an increase of cases in the young ages. We see also the increase of the rate of suicide. So we have to act here, coordinated at the EU level, with a lot of focus on prevention. We also devote some funds to digitalization. So digitizing healthcare will be one of the priorities, and we'll try to build an European health record network to interconnect what we have in some member states, and also to give the chance to patients which are moving from one country to another to use the health record, and to the medical doctor which is looking at him to consult the history of that patient. Of course, we have a priority on expanding the European reference networks. We would like also to fight against vaccine hesitancy and to promote vaccination. One of the priorities will be also our role on the international stage, and to reinforce EU presence in WHO, for instance, but not only, to be more present on the international stage. So a lot of priorities with inside EU for Health. And among these, mental health, prevention, and self-care will be a good tool for the future. It's important to use it properly and with a great efficiency.
Christian, yeah, I think using it properly is really an interesting question, because so many people in the health bubble are so excited that now there's a bit more focus, obviously, in health, and they want, every special interest group is asking for their program to be included in the EU for Health program. Do you think it actually makes maybe more sense then to just focus on cancer, just focus on digitizing health records, or should we be putting a little bit of money into each pot?
Well, we cannot go only in one direction, because it would be difficult, and it's clear that we have to settle some priorities, not so many. I just presented you the priorities that we agreed until now in the internal work in the European Parliament. On Thursday, I will have the shadow meeting with the representative of the other political groups in order to agree these compromises. We had more than 1,000 amendments. Of course, among these 1,000 amendments, a lot are on the priorities. In the same time, you're right, we cannot build a Christmas tree there with the whole areas, all disease, all the problems, all issues. Maybe we'll have 10, 12 priorities, and we'll negotiate with the Council. In this negotiation, we'll even decrease the number and concentrate on 5-7 areas, depending also on the view of the member states. But we cannot go in just one direction. In the same time, with 1.7 billion or 2 billion, let's see how much we can obtain also in the coming weeks and months in the negotiations. We cannot solve the problems of the health systems. The money are huge. If we look, if a citizen is looking to this number, but of course, comparing with what the member states are spending, investing, it's a better term than spending. What they invest every year, of course, this money is very little. And we could also finance coordinated actions, programs, initiatives, which apply to all member states. We cannot go and give money to the member states because this could not happen. So I believe the money will be enough for 5-7 big priorities, and we can make a difference there with training of personnel, with building the good strategies, with exchanging the best practices, in digitalization, even a pilot project, something very practical, giving some money to reference network, giving some money to European Commission EU Beating Cancer Plan. It's very important, but it will not be the only money. They will also finance part of the actions from the DG Santi budget. I think will be enough if we spend wisely and with good effect, but will not solve with this budget the big problems of the health systems in each member state.
Absolutely. Now we have a health economist waiting in the wings. Martin Postma, he's the Global Health Economics Chair at the University of Medical Center Groningen in the Netherlands. I probably mispronounced that city name terribly. But Martin, could you tell us a bit of what you think that Brussels should focus its money on?
Various aspects triggered me in what's been said so far. I see one of the things that was very interesting is, and you referred to COVID yourself, and many countries are now thinking about how to implement potential COVID vaccines, and the role of pharmacies is discussed there. And I am seeing the self-care as in particular as the interplay between European citizens and the healthcare professionals. It always has to be, I guess, safety first. So I think would definitely be that's always an important area for investigation. We know about potential, if you think about over-the-counter drugs, potential problems with the kidney, traffic accidents because of sedative effects, antimicrobial resistance. So that should definitely be always at the focus for controlling self-care. If you go in the report underlying some of what's being said by Ventura, they give a few very nice examples also on how the preventive role of self-care can be enhanced. And one is the statins, the increasing the use of statins of self-care. There are huge differences between European countries. Harmonization is needed, also definitely an area for further investigation. And we should, and COVID shows us this so clearly, the impact that disease has not only on healthcare, but also on the whole society. And another example given in the report I mentioned is the use of analgesics and how that can help reduce absenteeism and presenteeism. So not going to work, not optimally functioning at work, and all that is related, although to production, to societal costs. Again, I guess an area for investigation to get into the broad impact that diseases have and that prevention generally under-financed can have.
Absolutely. Now, you were talking about safety, and we have someone from the industry right here, actually in person. If you want to come up and sit next to me. So we have, I'm going to butcher your name, but it's Huarte Schwarze Tate? Close enough? Yeah.
Almost there.
Director General of the Association of the European Self-Care Industry. I'm really curious when we're talking about safety. I mean, can we really trust people to take healthcare into their own hands?
I hope we can, and I think COVID was a sort of a stress test to this, because I think we all have been asked to stay home and to do our utmost and to avoid visiting the hospital, visiting a general practice doctor. We were all asked to contribute to flattening the curve, which was very important. I do believe that today we have to face the reality, which is that our health systems are overstretched even before the COVID, and during the COVID it became actually very, very obvious. And we did stay home and we did take care of ourselves. We actually rushed to the pharmacies after we bought the toilet paper and the pasta. We went to the pharmacies to buy our paracetamol just to equip our stocks and make sure that if we get symptoms of cough and cold, or if we got the symptoms of the COVID, we had sufficient products to actually self-manage. And I think this is a great example to show that people can be relied upon. And I think COVID has also good things. So we discussed about mental health issues and about others, but everyone said, I mean, all the speakers said that they have been exercising, they have been looking into what they eat. So I think it's also a kind of, it's a call to our conscience. And I think self-care has been embraced to a great extent because of this. Of course, there are other things that should not be self-care. That's why we still have healthcare professionals out there helping. We also embrace digital technologies. We have been, I mean, especially the medical profession has been quite reluctant in the past to do the telemedicine services. But in the crisis situation, actually, a lot of things and barriers that we perceived existed had to be dispelled because there was no other way out.
Absolutely. Now, Clive, I see that you were raising your hand, but before that, I just wanted to remind the audience, I have not forgotten about you. If you have some questions, now is your chance to submit them to Slido. Clive, do you have a response to anything that the two additional speakers just said?
Julian, yes, thanks to all the speakers, and a couple of points came up, particularly around the inequalities, because as we were hearing people saying, well, we all went out and bought paracetamol, but we couldn't all do that. The worried well can do very well. They can stock up, they can stockpile, etc. But Eurostat data shows that people who are less well off are 5 times more health problems than the richest in European societies. And that impacts on real things. It's not just statistics. This is about dental health. It's about optical health and being able to access eye treatment, things that we're taking up from patients all the time and we're hearing about in local communities. And it's about mental health, where quite frankly, the EU has failed so far, despite tremendous efforts by people in DG Santé and the European Commission. It's been blocked. And now the WHO is taking up a new flagship on mental health. And it's really important that that works, because there's going to be a huge impact now. But Mr. Bousso is a great champion of what the EU can do. And it can do terrific things. It's not just in the EU Health Programme, and it's not just about money. It's about the added value. The whole EU is not just about funding. It's about working together. It's the economies of scale across the smaller systems, which, as speakers have said, some of the health systems are very vulnerable. Well, working together, we can help in shared partnerships on that. There's a pillar of social rights we're going to be working on in the next year in a social summit, which gives people new rights to health, access to affordable, curative and preventive health. We all need to be working on that. And frankly, you've mentioned several times, Gillian, the health bubble. We need to burst this bubble, get out the bubble, get out there, get into a health in all policies approach. The skills agenda that Christine has been talking about. We need skills for life. We need literacy through life from people from the early years right through workplaces to be able to cope with what is happening in terms of changes in the world of work, changes in our environments, to be completely literate and to be able to access and play our roles in that. The EU has a tremendous amount to do. It's not just narrow, it's all-encompassing, and it has a tremendous amount where we can help each other and empower each other, and that's at the core of health promotion, to empower ourselves and to empower healthy societies and well-being.
Absolutely, Clive. Now, health bubble. I don't know how you feel about being burst. We have some questions from you guys. First, we'll start off with Dorado. We have the question, how does this discussion contribute to addressing underlying determinants of inequalities in health outcomes and opportunities? And I'm also going to pair that with Alexandra L., who said, how can we avoid leaving behind those who have less capacity, financial, social, technological, physical, mental literacy to adopt self-care? And I think I'll go to Christine with those two questions.
So could you please repeat again the first one?
Yes, the first question is from Dorada. It says, how does this discussion contribute to addressing underlying determinants of inequalities in health outcomes and opportunities?
Yeah, so obviously we have seen that we can differ our populations into prosumers, consumers, and non-sumers. So with the prosumers, they were basically prepping ahead of time and knowing that this was coming because they all know they can easily understand information, and they acted, appropriately on it. And then we have our large group of consumers, and some of them are the worried well. They actually know what to do. They would need a bit of guidance, and they can act. And then we have a large group of consumers that, yes, have the skills, but they don't have really the trust and the confidence in themselves that they can do the care that is needed. And then we have a certain group I call the non-consumers, and they are those who are really hard to reach because of the inequities that we see in the society, also structural inequity that really strike very hard to vulnerable groups. And these can be, homeless or financially deprived, people out of work. And we will see the economic impact from the pandemic hitting really hard in the coming months as well. When this is said, I think it's also right to put a really large compliment to all those managers out there who had to deal with a really difficult situation for their companies and making the wheels turn despite this pressure. And they have actually managed to have the companies and institutions and schools and work, running under these circumstances. And a lot of those decision makers at all levels in communities, in organizations and workplaces have shown us that we are able to transform, and we are able to make much more flexible workplaces that actually promote health and prevent health. And we've been calling for this for many, many years, but within a few months we saw a big turnaround, and that was really, really good to see. I do hope that we can make this turnaround also for the most vulnerable people in society.
Absolutely. Now, do either any of the other panelists want to take a crack at that question? There's two questions, I should say. No, I have plenty of other questions for you guys. So we have someone, Carlos Camilos, I saw his question. What is the role of insurance companies in providing the venues for patients of all socioeconomic backgrounds to be able to take ownership of their health? I was curious, I don't know if Clive wants to answer that one.
I'm happy to make a contribution because I was really pleased, actually. I noticed Mr. Lanzi, who's the sponsor of this event at the start, was very quick to talk about the paucity of spending on prevention, talked about the 3%. This is one of the changes that need to happen, and it can happen through increasing numbers of private-public partnerships. Another EU program that I think we all ought to be looking at is the InvestEU program, for example, where there are great examples where there are private partnerships being leveraged through EU funding, and countries, I believe your country, Romania, Mr. Boursoy, is among them, who are using money for healthcare systems. Ireland is investing in primary prevention centres through these funding, and we can revolutionise the way. We don't want to go back to the bad old way, which has failed. I'm not going to say let's make an opportunity out of crisis. This has been a dreadful crisis which has hugely impacted millions of people and caused death and destruction. But we can learn how to build the new future. And it's quite clear that in the mixed European economies, then building effective public-private partnerships is an important way forward. And this is very much part of the self-care agenda. What can we learn to take forward so we build sustainable communities, that we do it through new technologies that are emerging, where very much a lot of innovation is coming through from sectors. And we need to work very closely together with health insurance companies companies to make sure that data and information is increasingly well used and not abused for incorrect profit, but is used to actually benefit well-being and societies. So there are lots of ways in which we can do this, and if we all work together, and that's why I talk about bursting bubbles, it's about partnership working, and there are ways that we can do this using existing mechanisms. We have the will, we have the ability, we have the potential partners, and I urge that we work together in practical ways, and health insurers are an important part of that partnership approach.
Absolutely. I want to bring it back to the room. Duarte, do you have any ideas about the role of insurance companies in self-care?
Not necessarily insurance companies, but I think a very important and interesting initiative we have seen, for example, in US during the COVID time, is where the states have provided a tax relief for actually purchasing, for example, your self-care products. So actually, you were encouraged as an individual to possibly not to resort to the professional care, but rather possibly buy some of the paracetamol and be ready for what comes. And then you were getting something in return in your tax claims in the year end. So I think not necessarily, and so it will depend on the national organization of the health system, but that sort of thing, and I'm aware that something similar exists, for example, in Portugal. So those things could be explored as a way to, for example, to provide to those that are capable to actually taking care of those themselves, and I forgot what the term was used by Christine there, but and then possibly others will need professional care. So I think there are some really great examples that we can look into and see how that could work.
And Martin, I'm going to ask you as well. Do you have any ideas about the role of insurance companies?
We do researchers do very interesting analyses with health insurance data. I think Clive also touched on it. But there is a lack of data. It's generally on prescription drugs, for example, and there's a lack of data in such databases related to self-care. And I would say that e-health, mobile phones, apps would give us now the opportunity to start augmenting such the databases of health insurance companies with data that tell us more about self-care, what types of self-care are used, and maybe even a little bit on lifestyle. It can be pilot projects first, but I think in the end, real-world data have learned us so much about many aspects in healthcare, and starting some work in including self-care would be very valuable. Artificial intelligence methods are more and more used. There was a huge EU program now also on that in that area, but we need the data.
Absolutely. Now, Duarte, I have not forgotten about you. Do you want to address this question? Because I also have another question for you as well, but you can take a crack at this one.
No, I just wanted to reinforce and going just in the line with our last speaker, to reinforce also the role of community pharmacists and community pharmacy as real-world data sources, and sources of data that is put in quality and related to a specific patient and patient needs. So also going for accessibility and equality in the use of this data, I feel that we can support patients. And also for this and the ability to provide health system and namely the payers, doesn't mean they are private or public ones, but to provide them with the good, relevant data, and of course also in and always in respect with the citizen or the people privacy, and according to what is the regulation on these matters. Just to reinforce that.
Absolutely. And one of the topics we haven't really addressed is the mental health of healthcare professionals. We have a question from Lucy asking, should pharmacists play a larger role in supporting patients to use self-care as they have through COVID? If so, what support do they need to do this?
It's a very good question. I feel that, yes, we are in circumstances and in a good role or position to take that responsibility. And going and specifically for mental health, what is really relevant and important, going for mental health of the professionals, but also from people, is to help everyone to understand clearly the relevant signs of attention. So to aware people of what are the relevant signs of possible diseases or something that should be treated. And also going for our ability and also potential to reinforce primary healthcare network. So to make us able, and this is going more specifically to the topic of what we need in terms of support to enhance our role, and it's something that PGU totally believes, defends and promotes, which is the strengthening the role of community pharmacists and community pharmacy at primary health care. We need to establish the bridges with the other healthcare professionals, and data, IT systems are able to bring all the walls down. We just need to work together in the matter and the interests of the patient, of the citizens, and this is part of our obligation. So I feel that we are totally able to enhance and to avoid burden of other healthcare delivers, I would say, and namely to drive an important transformation also going. And when we speak about self-care, which is to change this hospital-centered healthcare to patient-centered healthcare, and going through the communities, going to primary healthcare, going to accessibility, availability, and structured collaboration among professionals using technology in the interest of patient is something that we all should do. So we need support, I would say, to build these bridges, to connect everyone, and to put us work for what we are supposed to work, which is for patients, for citizens, and pharmacists are here for that.
Absolutely. Dorothy, you were talking about technology, and I have a really interesting question from Tessa Richards. This is for anyone on the panel. Do you agree access by patients to full e-health records is essential to effectively self-care, especially now with post-COVID-19 move to remote consultations? I don't know if anyone has an idea about that. Do you want to take a crack at it?
Yeah, and I have to confess, sorry, Duarte, I'm also a pharmacist, so I think this would be a dream to have where every patient actually has access to its health record. Because when you think what could be done next is that we would remove and reassure regulators that pharmacists can do more, for example, in recommending a product, because imagine if I have a migraine which has been diagnosed, it doesn't make sense to go to the doctor every time I feel that migraine is coming. So actually going into the pharmacy, which also a pharmacist has an access to my diagnosis, which allow more products to be accessible without actually turning into the professional care. So I think this would definitely be an enabler. And I think also hearing Mr. Bouchoy talking about this health record piloting cross-border things, I think also we would also call for inclusion not only of prescribed products, but they are self-care products, be it non-prescription medicines, food supplements, some of medical devices being taken by patients. They can interact, so it's important that it's part of the record. But also it's great when you travel cross borders and you don't remember or you don't know how it's called in another country, a product that you have been taking in your country. It would facilitate greatly access to actually to the products and to the solutions, because eventually products are used because you have something which needs to be taken care of. So definitely.
Absolutely. Now, Christian, that's so interesting because there's so much talk about digitizing health records and how important that is. I'm curious if you have any ideas about whether patients should have complete access to their own health records and what role that plays.
This is very clear, and of course, they should be the only one giving access to a medical doctor due to the necessity of having clearly privacy. At least this is what we did in Romania, and I had the chance. I'm a member of European Parliament since 2007, but 2013, 2014, I interrupted and I became president of the National Health Fund in Romania. And I implemented with European funds the pilot project for Romania, the electronic health record. And there, yes, it is good to give access to patients. They will become more responsible. They will be more knowledgeable. The health literacy will increase a lot. And of course, it would help a lot in order to interact with the doctor. At the European level, of course, we just have to make sure that the access will come from any point of European Union. The content, I believe, will remain a decision of each member state, because there are already member states which build the health records. They cannot change, add or remove things. Some European guidelines could come, but of course, member states will remain with the decision how to build their own health records. But I totally agree that as many information as possible is needed. And of course, any information about prescribed or not prescribed drugs, any information that could help a medical doctor and the patient himself to take care of him or her would be helpful. So here we have to be very careful.
Absolutely. I have a question from Jada again, but this is a very interesting question. How can we ensure self-care concept will not be hijacked by greater privatization of health and social care, and therefore being unaffordable for many? I don't know if Clive or Christine wants to answer that question.
After you, Christine.
Ladies first.
I don't know. Yeah, it's about hijacking. I do think it's about empowerment, really, when I think about self-care. And I think it's about creating environments where governments and other stakeholders support people's self-management, people's opportunities for self-awareness, and their opportunities for self-testing. And what we do see now is that there are lots of structural barriers that hinder people, both economically but also of accessible opportunities and financial opportunities to hinder the opportunities for self-care. So we need to overcome them, and I do think we need to also look ahead to the new normal. So also a lot of the measures that have been really highlighted and stressed now with the pandemic, these are really good habits and attitudes that we should keep. Maybe not the physical distancing, but washing hands, normal hygiene, good nutrition, and so forth. These are really good habits and attitudes that we should protect now and don't let go.
Absolutely. Clive, do you have anything to add?
I do. Unfortunately, and very tragically, I'm actually not sitting in the European Union at the moment as an English person. So some of my experiences from England, where I do see that national health services are at risk from inappropriate takeovers. And we've seen this through competition models, which have been proven not to work. We've experienced that in our local area. So care needs to be taken in moving forward. And that's why it's important that we have an integrated approach that involves people. And thanks, a load of great questions. Having informed patients and citizens playing a role in this and really building informed patient, citizen, public engagement into the decision-making process through design of services helps to be a barrier. And it also helps avoid some of the dangers around the security in terms of data access. I've got access here to my local records, which I've been able to use to good effect recently and to have good consultation. So I'm entirely well disposed to using the best of new technology, but to do it with caution and to make sure that it's driven by need, not by profit. And we can use all sorts of new methods here. And just in terms of the great question we had from Lucy about mental well-being, you know, we all owe so much to people on front lines, not just in health systems, but across public services. And there are exciting new ways in which nurses can play a role with community groups, in how the pandemic has shown that using civil society and new community groups working together, empowering people, is a marvelous new force for developing the wider health. For nutritionists, we've done work on a European joint action with ministries called CRODIS, where we are seeing that they are working on new care models, including self-care. So a lot of what Duarte said was absolutely right, and pharmacists will play an important part in those new models, which will be implemented across the European Union, and CRODIS will announce their results soon. But we haven't really talked about workplaces, not only for health professionals, but also for all of us, where there is a role where we can improve and maintain and protect our own health. EU legislation and regulation has an important part in that, but so does the role of people like occupational health advisors, physiotherapists, which is often denied in care packages at the moment, can be enormously helpful in preventing pain from arthritic conditions, musculoskeletal conditions, for example, and a tremendous amount can be done in terms of the wider health workforce, the wider public health workforce, to bring forward that new approach, which I know Tessa Richards does a lot of writing on these sort of subjects and talks a lot about the importance of having access throughout systems so that people can be empowered and we can work in these new exciting partnerships using the tools, but it's people leading it, not the products.
Absolutely. Dorothy, I have the last question for you, then I have to wrap up. I have a question from someone named Else. During COVID-19, regular care was not available nor accessible. Which positive, sustainable learning for self-management did you see throughout the pandemic?
Well, I feel that this pandemic, as it has been already said, has huge challenges to overpass, but of course also gave us the possibility to find creative solutions for people's needs. And now is just the topic and the moment to make us take the responsibility to lead the transformations that we need to drive in order to needs. And one of the topics considering access was, for example, and Jurate already said, the development of telemedicine. It's something that is critical and important, but also this ability of the different healthcare providers to drive their role. And of course, since we are telling people to say, or we are telling people stay at home, we need to reinforce our ability to take care of them closer. We need to reinforce our ability to take care in the community. And that's why, and it's of course what we feel, and we totally defend new responsibilities and enhancing roles for pharmacists, of course, in collaboration with other healthcare professionals. Something that has been critically and very importantly said here is the role of all health professionals working together in response to patient needs in a structured way, in a collaborative way. And I would like to tell that, of course, we can anticipate that this pandemic, we just know that this pandemic arrived, okay? We cannot be completely sure when it will over and what will be the challenges or the transformations that we still need to put in place. But we need for sure to deliver healthcare in a patient-centered way. This is something that came for stay. This is part of the lessons to all of us, health professionals, regulators, policy decision makers, and we need to put the resources where they need to be, and they need to be put on prevention. They need to be put where people understand them to be. And also link with that, I would like to say that we have a tremendous challenge to control COVID-19 pandemic, but we cannot skip or miss all the other pathologies, all the other problems, the chronic problems and the chronic diseases that existed already before the beginning of this pandemic in Europe, and all the other new diagnoses that we are skipping probably because we are not putting in place all the prevention and all the screening abilities. So we need to transform our abilities and frequencies and to make it closer to people. And pharmacists are here to take responsibilities on that. Also vaccination.
But thank you for wrapping it up there. I could not have wrapped it up better myself. This is the first of hopefully many more conversations about the importance of self-care and mental health in the EU, both during the pandemic and after the pandemic. I want to thank everyone, especially the panelists and our people in the wings, for being here and having this conversation, for everyone listening, and of course to our sponsor GSK. Politico, of course, has other events that we're doing virtually. If you go to politico.eu/events/future.events, then you will see them there. Thank you so much.